Well, we've been partnering with Ozark Orthopaedics and learning all about the procedures the doctors are doing to get those with injuries back on their feet.
That's right. This week we meet Dr. Jeff Johnson and Lee Kelly, who tell us about treatments for tendonitis. Take a look. We are continuing visiting with the professionals at Ozark Orthopaedics. We've got Dr. Jeff Johnson here today. Thank you so much for taking the time to join us.
Hey, thanks a lot for having us.
Absolutely. So we were just visiting with Lee about his tendonitis, and you specialize in that. Can you tell us more?
Sure. So I'm a fellowship-trained hand, wrist, and elbow surgeon, and I met Lee after an injury. Obviously, he's a CrossFitter, and I CrossFit as well, and that's sort of how we knew each other, is that once he was injured, they said, well, hey, Johnson CrossFits, you should go see him. It just happened that I was the right guy because I do elbows. But he started off with pretty significant tendonitis and had been treated by somebody with several steroid injections and was training very hard for an event and ended up rupturing his medial collateral ligament of his elbow.
In the early days of CrossFit, we opened our doors in 2008, and there is what's called the CrossFit Games. It's like the Super Bowl of CrossFit. We had qualified a team for regionals. They had released the workouts. Throughout that training season, I was experiencing a lot of tendonitis in my elbow. About a week before, 2 weeks before competition, I went and got a cortisone shot in my elbow to try to minimize or mask some of the pain. And I was doing overhead squats, which is with the barbell, you know, going down into an overhead squat with a heavier load. So I felt a big pop in my elbow. I immediately knew something was wrong, and went to the ER. They said, yep, you tore a tendon in your elbow, your UCL, ulnar collateral ligament, and ended up being scheduled for surgery with Dr. Jeff Johnson at Ozark Orthopaedic in Fayetteville. Prior to the surgery, I met with him and I explained the importance of still being able to Olympic weightlift. And Dr. Johnson did a really good job of doing the research. After the surgery was over with, still 10 years later to this day, I have zero issues, no pain in my elbow. I'm still able to lift as much as, if not more, than I was prior to the injury.
And so oftentimes patients are diagnosed as having something like tendonitis when really they've got something else going on. And that's probably what Lee had, was a developing ligament tear, and then finished it off with this Olympic weightlifting move and ended up with a torn ligament, which at that point he's not lifting weights anymore. So then that's how we met.
Sure.
Got it. Yeah.
Is that a common injury you see with athletes, maybe ones that are doing the CrossFit?
You know, it's pretty uncommon in general for people to get significant injuries doing CrossFit, and I think that's sort of a misconception about CrossFit in general, is that it's a dangerous sport. It's really hard to get hurt on your couch, and so inactivity, I think, is probably more dangerous. And so as an orthopedic surgeon, I see far more injuries with folks doing things like riding mountain bikes or driving cars. But in CrossFit or Olympic weightlifting is that overhead lifting, and what he did was something called a snatch, where his elbow was straight over his head, and that puts an incredible amount of force here. And if you watch the Olympics, a fair number of people with that maneuver can injure that ligament. So for that particular weightlifting maneuver, yeah, it's not uncommon. But this is something that's seen in baseball a lot. So with a rupture of the medial collateral ligament, people hear about Tommy John surgery, and that's what I eventually did for him.
For the Tommy John surgery, what is the recovery process like?
So when we reconstruct the ligament, in his case, I used a ligament from his forearm. So you have to rob Peter to pay Paul. So I took a ligament out of his forearm, or a tendon, and then reconstructed this ligament, just like we do for ball players. Now, I'm from here, but trained in Philadelphia and took care of pro athletes and collegiate athletes. We do the same here with recreational athletes and collegiate athletes. And so when we reconstruct the ligament, then you have to be in a brace for a period of time. So you have to, one, recreate stability in the elbow. Two, you have to immobilize the elbow long enough for that ligament to heal, because I don't heal people. And then three, you have to get motion back. So there's a fair amount of rehab afterwards. First, to regain your motion, and second, to regain your strength. And then lastly, to return to sport.
Thank you for taking the time to visit with us today. It's always great to hear from the professionals at Ozark Orthopaedics.
Thanks for having us.
Thank you
Absolutely.
so much, Dr. Johnson.
Yes.
Appreciate you.
Stay with us. We got more Good Day NWA coming up right after this.